And good afternoon, everyone. Thanks for joining us on our media briefing today. Sorry we're getting late, a minute or so late, but let's get going. We have some guests with us today that are going to give us some great insight into vaccine and vaccine management and planning ahead for vaccinating clients. We're very pleased to be joined by members of our Monterey County Health Department Clinic Services. And I have Prashant Shinde, our Monterey County Clinic Services Bureau Chief, and Dr. Caroline Kennedy, who is our Clinic Services Medical Director here today to tell us more about that. Good afternoon.
Good afternoon.
Good afternoon. Happy to be here.
Thank you. Go ahead and tell us more about what's happening in clinic services and vaccine.
Absolutely. Thank you. My name is Prashant. I'm the Bureau Chief for Monterey County Clinic Services. Just a background, we are a primary care community health center. Currently, we have 10 clinics here in Salinas and Seaside area, and we collectively see about 50,000 patients every year. So there are 50,000 patients in the community who call us their primary care medical home. Just in terms of preparing for vaccine, we have been working very closely with public health departments since last 2 to 3 months for us to be able to be ready for us to receive, store, and ultimately administer the vaccine. We have made all the necessary staffing, staff trainings. We have all the necessary supplies on hand, all the necessary storage capacity for both Moderna and Pfizer vaccine. We are just awaiting for 3 ultra-low temperature freezers, which are required for the Pfizer vaccine. There was some delay in the shipping. We will be receiving those freezers in first week of Feb. But we do have an alternate plan of using dry ice if needed in case the vaccines became allocated to us. In terms of micro planning for vaccine administration, we are well prepared at this moment to receive any amount of dose for our patient population. So we can receive as less as 1,000 doses, or we can receive more than 1,000 doses, and we will be able to administer them very swiftly. Just to give an example, under phase 1A, when public health allocated us vaccines to vaccinate our staff and other community members who are in phase 1A and tier 1 to 3. We received the vaccine in the morning at around like 9 a.m. and we were able to vaccinate 12 of our staff members in the afternoon. So we are ready, and Dr. Kennedy can go into more details about the process of actually administering the vaccine. In terms of planning ahead, broadly, there are 2 options right now which we are anticipating and we are already prepped for. One is to vaccinate large number of a patient population in shorter period of time. And what does it take for that is basically for us to make some changes. We have already worked with our EMR vendor, the electronic health records vendor, to make the registration as simple as possible. We are calling that a mass vaccination module that will allow us to schedule and register the patient in a short amount of time. We administer the vaccine, and then most importantly, all the providers who vaccinate are required to report back the vaccine information and some basic demographic information to the state. So the EMR already does that. So that's one option, and we will be utilizing that once we receive a large amount of vaccine allocation. The other option is to just have dedicated vaccine clinics, or we can also vaccinate routinely as an office visit. So I think at this moment, it all depends upon the supply and demand. Since there is a limited supply, we can vaccinate any doses which we can get our hands on. I would like to take a pause at this moment and see if Dr. Kennedy would want to add on this. Dr. Kennedy had observed health departments, vaccine clinics, and she has some good insight on this.
Excellent, thank you. I'm Dr. Caroline Kennedy. I've been serving our community for 20 years. I'm a primary care provider. I'm a family physician. I see patients in Seaside and I've been the medical director of these clinics for 10 years. And I just want to let you know that we are extremely nimble for change. We have 200 clinical employees, and we are been one of the top vaccinators in the state for example, for teen vaccines. We rank in the top 5% for vaccinating of children. So we have, this is what we do all day, every day. And if we see 650 people a day on a normal day, for us to pivot to vaccinate people wouldn't be very hard for us to do, wouldn't be hard for us to do in high volume. Our providers are almost all bilingual. Our staff is almost 100% bilingual. So this is exactly the patient population in our community that we already serve. We know from many experiences that our patients prefer to communicate with us on the phone. We are currently monitoring only 10% of our patients go onto MyChart, which is the patient portal to get their results for COVID tests. So we are aware that patients aren't going to want to all go onto a patient portal in order to sign up for vaccine. We have our own dedicated call center, which we can pivot and add some more of our employees to answering phone calls if that's how we're going to get patients vaccinated. Our electronic medical record named Epic is very nimble as well, as Prashant referred to. Also, it allows us, I've heard other questions about how do you know when people are due for the second dosage? Well, we already have those reports built in Epic, so we can run them. It takes about 30 seconds to run it to find out who, what age needs the vaccine, who's received one dose, who hasn't received the second dose. We do have about 20,000 patients 16 and over who would qualify for the vaccine. According to our electronic medical record, we have about 850 over the age of 75. So we can really leverage that technology to help us find our patients. I wanted to say that we, like he mentioned, we received vaccine at 8 o'clock in the morning. We thawed it at noon and we vaccinated in the afternoon. This is just how we move as a public health entity. We've also been focused on vaccinating our, for the last 30 years, and our whole, before I even hire a provider, I make sure they're on board with vaccinations. We were able to watch Natividad's vaccine. I was able to watch and interview all of the people at the health department high volume CSUMB vaccination to learn best practices. But from what I can see, it's a lot of what we already do, learning the tricks of how to reconstitute the Pfizer vaccine. I have no doubt that our team can learn the technology and learn how to do this at high volume very quickly. So we are, just like the rest of the public, really waiting for vaccine.
Thank you very much, Dr. Kennedy. Prashant, is there anything else you'd like to add before we move on to the next speaker? And if you would both stay for questions after Dr. Moreno speaks.
Absolutely. I would request Dr. Kennedy to just elaborate one more thing, our ability, how our providers can also identify high risk and at-risk patients in EMR. That's something which we can do if you want to create a wait list and if you want to prioritize. So Dr. Kennedy, can you please elaborate?
Yeah, I mean, most electronic medical records have an ability to create wait lists in accordance to how patients call in for example, if you're just doing first come, first serve. But we also have abilities to run reports based on diabetes, hypertension. Actually, transplant patients are at very high risk. Patients who have chronic kidney disease that really would benefit from it. So we have that at the fingertips of our providers. Of course, providers know their patients best. So we really give them the tools to run the reports and ask them, you know your patients best. Who do you think, with a little bit of provider input, should be the first week that we call people in? So I think you leverage technology, involve your providers, and then more importantly, you put your patient at the center of this experience and you involve them.
Thank you.
Thank you, and thank you both. Very interesting and very informative. And if you would stay on the line for any questions after Dr. Moreno speaks, or we'll open it up for questions from our press corps. We have Dr. Moreno on the line today. Always a pleasure to have him on the briefing for an update on public health. Hi, Dr. Moreno.
Hi, Maya. Good afternoon. Good afternoon, everyone. Good to see you, Dr. Kennedy and Prashant. I'm going to talk a little bit about the variants that have gotten the attention of California Department of Public Health here in California. The first is a variant known as B.1.1.7. And first of all, we have, there are hundreds of variants that have been identified through genomic sequencing here in the United States. And our state is participating in genomic sequencing in partnership with UC San Francisco and other laboratories. And so we and other laboratories are submitting some specimens from confirmed cases to these laboratories, and they perform genomic sequencing. The B117 is one variant that has been shown to be more transmissible than the early strains of SARS-CoV-2, which causes COVID-19. And the concern that California Department of Public Health has is that because it passes more easily from one person to another, that it may have an influence, if it becomes more prevalent, could have an influence on the trajectory of our cases and case rates. And so the state continues to conduct genomic sequencing, looking for this particular strain. We don't have enough surveillance of samples in California to say definitively how prevalent this strain is, but in speaking with folks from the state, it sounds like it's still a very, very low percentage of cases are caused by the B117 variant. The reason I bring this up is because just want to share with community that we are here locally following the results of the testing that is being done on strains of, looking for different strains of COVID, virus that causes COVID-19, so that we can have an understanding of whether or not there is something that we need to do, continue to do, or do differently here in Monterey County. So for now, the take-home message is that there are many variants out there. Some of them are more transmissible, and we will continue to work with the state to send samples up for testing. But people, what I want people to understand is that it's still very important that we all continue to practice measures that can reduce transmission of COVID-19 virus. So continuing to stay home as much as possible, wearing face coverings when we leave the house, keeping our distance and washing our hands. There's also another variant that's gotten the attention of the state, and that is L452R. Now, this variant has been detected in California since November of 2020, and has recently been responsible for outbreaks at skilled nursing facilities in Santa Clara County, primarily. However, it's also been found in the counties of Humboldt, Lake, Los Angeles, Mono, Orange, Riverside, San Francisco, San Bernardino, San Diego, San Luis Obispo, and has been detected in Monterey County. The concern about this one is that, well, I'm sorry, what we're looking at is, the state is looking at is whether or not this particular variant has a different transmissibility, similar to the B117. Is it more transmissible, similarly transmissible, or less transmissible than the current predominant strains of the virus? So that's one thing that the state would like to look into, and also investigate whether or not this particular variant is associated with greater risk for serious illness, or whether it has the same risk for serious illness among Californians. So this is another one. This one is more, the state believes this one's more prevalent than the B117. So the state will has let us know that they are looking to investigate, find out more information, and begin to share that information with us at the local level. So to let us know if there's any action that we need to take, and any action that we would need to advise the public or healthcare providers take. And then the last thing is, as these variants begin to be investigated, the state will also be looking into whether or not the current testing mechanisms that we have, the antigen test and the PCR test, will continue to be able to detect these variants, or whether there will be some new limitations in the ability to identify these variants when they occur in Monterey County residents. So that's other information that we hope that the state will be able to share with us, so that we can provide guidance to providers that are testing, so they would be able to at least make the most of the tests that they have, and use the test in the appropriate settings to have the best outcomes possible. Let's see, I'll talk a little bit about the vaccine now. We are still in tier a phase 1A, tier 1, we are still, we and other organizations are still conducting vaccine clinics to vaccinate healthcare workers in phase 1, and also providing second doses to their own healthcare provider employees. As far as moving into phase 1B, we know what the state had recommended, that is we prioritize individuals 65 and older in phase 1B, tier 1. So we're looking for, there is some additional guidance that the state has made available, and we continue to review that guidance in anticipation of moving into 1B, tier 1, hopefully soon. Let's see, Matt. I do have some update on the allocation and administration of vaccines here in Monterey County. So the most recent report that I have available to me on number of vaccines allocated to Monterey County is 31,525. And that's how much has been allocated. I don't have an update for the number of doses administered by CARE. We're looking at running those weekly, but the latest numbers I have are a total of 11,449 doses administered, and that is as recorded by CARE, which is State Immunization Registry. That registry, we know, does not include all of the doses that have been administered to Monterey County residents, nor does it have all the doses that have actually been administered to Californians. So there is a limits to the how we can use the CARE system. The state is aware of it. The counties have shared that shortcoming of the CARE system with the state. The state is looking to see if there's something they can do to update the CARE system to have more better data. Also looking at ways to make sure that providers that are vaccinating are entering information into CARE in a manner in which increases the reliability of the transfer of that vaccination information from a provider's electronic health record or similar system into CARE, and that it doesn't get blocked or hung up somewhere and missing from the total amount that's being administered. We have, excuse me, I also want to give an update on the California Department of Public Health's recommendation to pause administration of the Moderna COVID-19 vaccine. So as the state reported, there was a higher number of adverse events at a community vaccine clinic. Apologies, I don't know what county it was, but I believe it was in Southern California. And there were reportedly fewer than 10 individuals that actually had to receive medical attention for the reactions that they had. They appeared to be having an allergic reaction, which is a known side effect of the vaccine. And these were observed during the standard observation period that all providers are conducting after a person receives the vaccine. The lot involved is 041L20A, and there were a little over 330,000 doses from this lot that have been distributed to 287 providers across the state. Those shipments arrived to providers arrived in California between January 5th and the 12th. And I looked, and we have some, looks like preliminary numbers, but it appears that we have an estimated 6,100 Moderna doses from that lot that were shipped to Monterey County. In looking at who received those vaccines from that lot, it still appears that it was only delivered to our 4 hospitals. It appears also that 4,700 doses are currently paused. So the hospitals have been asked to not administer those vaccines either for first dose or for second dose. And approximately 1,400 doses were already administered. So again, about 6,100 doses from that lot shipped to Monterey County, with 4,700 paused and 1,400 already administered. California Department of Public Health has asked providers to, have suggested that if providers have Moderna vaccine from another lot, to go ahead and continue vaccinating with alternative lots. Our staff here in the health department are doing what we can to work with the 4 hospitals to find a way to find a vaccine that is that they have that they could use in lieu of that lot of vaccine, or if possible, there may be ways to move some vaccine around the system in order to avoid canceling any already scheduled clinics and appointments. So we hope that we can avoid canceling some clinics and appointments. We'll do our best to work with the hospitals and see what we can do to make sure that people who have appointments can keep their appointments and get vaccinated. We can't we can't give a Pfizer vaccine to someone who's already received the first dose of Moderna vaccine. It has to be Moderna. But if somebody hasn't received any vaccine and they have an appointment, there may be an opportunity to administer Pfizer vaccine instead of Moderna vaccine if, at the hospitals. And I'll stop there and see if I'll do my best to answer questions, Mia.
Great, thank you very much. And I do have some questions that have come in, so we'll go ahead and get started. The first question is for clinic services for Prashant and Caroline. Are you anticipating and prepared for a lot of new patients coming to you exclusively for vaccine?
Yes, we are definitely anticipating. We have, in fact, our call volume has gone up, and we have seen a lot of new patients asking about vaccination. But I think it all depends. We'll take direction from the public health, how we want to handle a large volume of those patients, or those persons who are seeking vaccination who are not our patients. We can give one example. When we received the first allocation under phase 1A, since the shipment is received in doses of 100, we received 300 doses, and our head count is 274. So we were able to vaccinate additional staff like Behavioral Health Bureau and other community primary care providers and one dental provider. So definitely we can, but it all depends upon how many doses we get, and within that tier, how many our own patient population is eligible. We would prefer to give and vaccinate our own patient population, and then definitely we can take care of new patients.
And I just wanted to add that we are a federally qualified community health center. So in our basic DNA and our culture is that we are here for the community. So we tend not to turn people away, including when we've been doing testing, patients with Blue Cross, Blue Shield, people that got my name off the website, anyone that has been able to, if we have had space to accommodate them, we try to accommodate new patients, whatever the community needs. That said, we don't know. We've watched at some of in San Jose with Sutter, some things just crashed because of the volume when they announced that they were vaccinating. We just need to be careful. I don't want our own patients, who are usually the most needy patients, who are really polite and stoic, and I just need to make sure that we are able to balance their needs with whatever other needs in the community we have. I can tell you culturally, our providers are asking when they can work on the weekends. We have people volunteering to do more. I think that the whole community has been volunteering, and I agree that paramedics and firemen helping out, it is everyone can pitch in, but so we will do whatever we can. We just would like to get some vaccine.
All right, thank you for that. Continuing with questions. This question is for you, Dr. Moreno, and I know there was a slight audio glitch when you were giving some of the statistics. So this might be a repeat of something that you said, but some people have asked for a repeat. How many vaccine doses does Monterey County currently have, and how many people have been vaccinated so far? Is the county actively petitioning the state to get more vaccine?
Okay, so specifically Monterey County Health has 13,000 doses allocated to the health department. Of that, again, the care system does not record all the doses that have been given. The other thing I can point out is that some of those vaccines have been redistributed to other organizations. So as we find reasons to redistribute the vaccine within the county, we're going to, we'll have to find also ways to effectively track where those vaccines have gone. Overall, for the entire county, the county has received 31,525 doses to all providers countywide.
And then is the other question was, is the county actively petitioning the state to get more vaccine?
Good question. I'll have to go back and check with our planning team to see if we've done that.
All right. And then another question for you regarding the allergic reactions to Moderna. How severe were the symptoms for the person or persons that tested positive for that variant strain, if you know, and how many of these variant-related confirmed cases are there?
Can you read it one more time, please, ma'am?
Sure. How severe were the symptoms for the person or persons that tested positive, and that I think what the reporter means is, and that received the or had the L452R strain? How many of these variant-related confirmed cases are there?
Okay, so we don't know how many cases there are of the new strain in California, and that's because we don't have in California we don't have yet the amount of surveillance testing necessary for the state to announce an estimated number or estimated percentage of cases that are due to the L452R variant. We don't have information as to whether or not people who have the L452R variant have more or less adverse reactions or allergic reactions when they get the vaccine, if that was what someone was asking for. And then finally, what we know about the individuals that had the allergic reactions when they received the Moderna vaccine, what we know is what we read on the state website, and that is they had allergic reactions. I also know what was shared with us in conference calls is that many of these people actually required epinephrine, and that's a part of the support and initial support and medical response that vaccinators are trained to provide. And so they received the epinephrine, 1 or 2 doses of epinephrine, and then were the clinic staff assisted the individuals in seeking transport to hospitals for further evaluation. We've been told that the individuals that were reported to the state who had these reactions and sought higher level medical care were all discharged from the hospital and are doing fine.
All right, thank you. Another question for you. If we have enough vaccine, what is the maximum number of people the health department believes could be vaccinated in Monterey County per day?
Okay, thanks, Mia. So if we have, right now the rate limiting step is vaccines. So we have healthcare providers who have stated their interest in beginning to vaccinate not only their own employees, but patients and priority populations. We have other employers like ag employers who are also interested in vaccinating their employees in B1. We have pharmacies that are currently vaccinating, and we have pharmacies that would like to vaccinate. And we have our own health department staff and contracted providers that can also contribute. So we have quite a few organizations right now that want to vaccinate if they were given enough vaccine in a variety of models. So the total number of vaccines that could be given out every day really depends on the maximum capacity of each organization. And that would really depend on where we're at as a community. So I can't give a number. It really depends on what's going on in the community. So for example, hopefully we're approaching what may be a peak in the current surge. But if we continue to have this surge or it gets worse, hospitals may be very limited in their ability to contribute to vaccination efforts. I'm sure they would do their best. They want to vaccinate, but they would have to pull staff away from other duties as assigned during a surge. So that's just one example of conditions or factors that influence how many vaccines we can give. The other would be the ability of employers to participate. The more that employers participate in vaccinating targeted priority groups, the more we'll be able to vaccinate. And to do that, we're going to also need more volunteers. So again, I can't. It's a great question. I wish I had an answer to it, but we don't for a variety of reasons I just stated. But I do believe that in Monterey County and in California, I would hope that the rate limiting step continues to be the vaccine, meaning if we get vaccine, we'll have a way to vaccinate people. It's in order to always be ready to vaccinate individuals, we need to make sure that we are continue to work with other employers, other sectors who can contribute resources, work with other sectors who have locations like large parking lots at venues where we can have large drive-through mass vax events, and also for people who are interested in have not yet volunteered to submit. They can submit an application at our county human resources website to be a volunteer, to be vaccinators if they're licensed, or to assist at vaccination clinics. Or people can also contact their any community-based organizations or other associations that they're affiliated with and express their interest in volunteering. So at least we have the staff to maximize the use of any vaccine that we get.
All right, thank you. Another question for you. Monterey County's vaccine webpage has not been updated in almost a week. Why?
I don't have an answer for that. If there's anyone that manages our website on the phone, maybe on Zoom, maybe they can answer.
And if not, I can forward that question to the Health Department webmasters and try to get a response.
Okay, thanks, ma'am.
Continuing on, another question for you, Dr. Moreno. How many doses of the Moderna lot, was sent to Me Memorial Hospital? Do you know?
I don't know how much was sent specifically to Me Hospital. I have the total for the 4 hospitals. I might suggest that if anyone on the call has specific questions about the utilization and pause of Moderna, that lot of Moderna vaccine at the hospitals, that they could contact the hospitals and ask the hospitals directly, who would have more detailed information than I have.
Okay, thank you. And then continuing with you, Dr. Moreno, Dominican Hospital, Kaiser, and Sutter Health in Santa Cruz County have begun vaccinating people age 65 and older. Are local Monterey County hospitals like CHOMP doing that? And is that a question that you can answer?
I can probably give a little bit of response based on what I know, and that is that Kaiser and Dignity are examples of multi-county entities. Those are, I think there's about 10 of them across the state, and early on in the state's planning efforts to decide how to allocate vaccine that comes to California, it was decided that when the CDC sends a notification of allocation to California, California would take a portion of that vaccine and allocate it to the Kaisers and the Dignities of California. And so those entities have been like Prashant and Dr. Kennedy and the 4 hospitals have been vaccinating their own healthcare providers. But they also have, once they feel that they've vaccinated their healthcare providers, if they have available vaccine, they like us want to get the vaccine into people's arms. So in discussions that I participate in on the statewide level, we do know that the multi-county entities are operating and moving through the phases and tiers a little bit differently than healthcare providers in counties that don't have multi-county entities. So it does cause, I understand why it definitely would cause some raised some interest among counties that don't have multi-county entities as to why there's a difference. But that's what I know, and that's what's been shared with us. And so that may hopefully partly explains why some counties with multi-county entities are vaccinating begin vaccinating into 1B, and other counties have not.
Right, thank you. And then what it looks like this might be our last question. Are other counties getting a lot more vaccine than Monterey County, like Los Angeles, which is opening mass vaccination sites?
I don't know that other counties are getting, and when we say more, I'll put it in terms of proportion or a county share of vaccine. The state, what I know is that the state continues to use formulas that take into account partly issues of equity in deciding how much vaccine goes out to each county. And again, that's after vaccine has been taken away for the federal, state organizations and the MCEs, and also the skilled nursing facilities. So what's left over goes through a formula and comes out to counties based on that formula. The other thing that the state will do is modify that formula from time to time. So based on the governor's statement that he and the state would like to have locals prioritize individuals 65 years and older, I believe what we were informed of just recently was that the state is now incorporating into the formula or factoring into the formula the number of individuals in each county that are 65 years and older. So hopefully we'll get more information about that. But just as an example, if one county has a greater proportion of their population that's 65 and older compared to another county, that first county might get an adjustment to their allocation to account for more people falling into the 65 and older proportionally compared to other counties. So that's we're waiting to hear exactly how that formula is going to play out in determining which could determine some or result in some changes in our share of vaccine that comes to Monterey County.
All right, thank you. That is all the questions that I have in chat. If anyone has any additional questions, go ahead and send them now. And I'm not seeing anything coming in or hearing anything. And so with that, we'll wrap up our briefing for today. Thank you all for joining us and providing really interesting information. Our next media briefing is next Wednesday, and we'll see you then. Good afternoon, everyone.
All right, goodbye, ma'am.
Bye.